Welcome to the stories on Echoes of Revenge. Step into a world where love turns dangerous, revenge feels inevitable, and every story drags you deeper into the shadows of desire, betrayal, and the human heart. Let's begin today's story. The grand ballroom of the Metropolitan Museum sparkled with crystal chandeliers and flowing champagne as New York's elite gathered for the annual Children's Cancer Research Gala. I stood near the silent auction tables, watching my family work the room with practiced grace, their designer gowns and confident smiles marking them as members of Manhattan's philanthropic society. Madison's pharmaceutical research grant was approved. Mom announced proudly to a circle of impressed donors, her hand resting on my sister's shoulder. $2 million to develop pediatric cancer treatments. She's going to save so many children's lives. Madison preened in her custom Valentino gown, her medical degree and research credentials making her the evening's star. The breakthrough potential is incredible. We're looking at treatment protocols that could revolutionize childhood leukemia care. I remained at the periphery, exactly where I preferred to be during these gatherings. My simple black dress drew no attention among the peacocks displaying their charitable contributions and professional achievements. Such meaningful work, Mrs. Whitmore gushed, writing another check for Madison's Research Foundation, using medical expertise to help society's most vulnerable members. The irony wasn't lost on me. While Madison researched childhood cancer from her laboratory, I was living with adult lymphoma that my family refused to acknowledge as real. "And what about your other daughter?" Senator Richardson asked politely, his gaze settling on me with charitable interest. "Oh, Catherine's been having some health anxieties lately," Mom replied with practiced dismissal. "Nothing serious. You know how some people become obsessed with medical symptoms." The conversation that haunted every family gathering had arrived. Madison's confident smile suggested she was ready to deliver her favorite diagnosis of my character flaws. "Honestly, it's embarrassing," Madison said with medical authority. "She claims to have lymphoma, but you don't even look sick," she added, gesturing toward my carefully applied makeup that hid the worst effects of chemotherapy. The assembled philanthropists nodded sympathetically, clearly familiar with family members who manufactured medical drama for attention. "Stage 3 Hodgkin's lymphoma," I said quietly, though my voice was barely audible over the gala's ambient noise. "See?" Madison laughed, the sound cutting through the ballroom's elegant atmosphere. "She's memorized all the terminology. Classic hypochondria behavior." "The medical appointments are constant," Dad added with parental frustration. "Oncology consultations, blood work, radiation therapy sessions. She's convinced herself she needs cancer treatment." If only they knew that my "convinced herself" diagnosis had come from the same medical center where Madison conducted her pediatric research. Or that I'd been timing my chemotherapy sessions around family events to avoid disrupting their social calendar. "Catherine's always been the dramatic one," Mom explained to the concerned donors. "While Madison pursued legitimate medical education, Catherine developed these imaginary health crises." My phone buzzed against my evening purse. A text from Dr. Peterson's office reminding me about tomorrow's scan results appointment. The ones that would determine if 6 months of chemotherapy had been successful or if we needed to discuss bone marrow transplant options. Through the ballroom's towering windows, I noticed a familiar figure approaching the museum entrance. Dr. Peterson himself, still wearing his hospital ID badge, carrying what looked like medical files and pathology reports. The sight of my oncologist arriving at a cancer research gala could mean only one thing. Dr. Peterson entered the Metropolitan Museum with the measured stride I'd come to associate with serious medical discussions. His presence at a cancer research gala wasn't unusual, but seeing him approach our family's table with medical files suggested this wasn't a social visit. "Ms. Catherine Morrison?" he said quietly, his voice carrying the gentle authority that oncologists develop when managing difficult families. "I apologize for interrupting, but we need to discuss your latest pathology results immediately." The philanthropic conversation around our table faltered as a distinguished physician in hospital attire approached with obvious medical urgency. "Pathology results?" Dad asked with growing irritation. "Doctor, I think there's been some confusion. Catherine doesn't actually have cancer. She's been experiencing medical anxiety." Dr. Peterson's eyebrows rose as he took in the charity gala setting and my family's dismissive expressions. Medical anxiety? She's convinced herself she has lymphoma, Madison explained with her research credentials lending authority to her amateur psychology. Classic hypochondria behavior. We're trying to get her proper psychiatric help. The silence that followed was broken only by the gentle clinking of champagne glasses from nearby tables as other donors continued their charitable evening, unaware of the medical crisis developing at our table. I see, Dr. Peterson said carefully, his experience with cancer families clearly including situations where relatives denied reality. Ms. Morrison, do you have permission to discuss your diagnosis with your family? I nodded weakly, knowing that the next few minutes would destroy both my family's gala celebration and their assumptions about my character. Dr. Peterson opened his medical file and pulled out several pathology reports, spreading them across our charity auction table beside the expensive donation pledges. These are your daughter's tissue biopsy results, he announced to my stunned family. Classical Hodgkin's lymphoma, stage 3B with B symptoms, confirmed by 3 independent pathologists. Mom's champagne flute stopped halfway to her lips. Dad's charity auction paddle clattered to the table. Stage 3 lymphoma? Madison's voice cracked as her medical training supplied details she'd been refusing to acknowledge. But that requires immediate aggressive treatment. 6 months of ABVD chemotherapy, which Ms. Morrison has been receiving faithfully, Dr. Peterson continued with clinical precision. She's scheduled treatments around your family events to avoid disrupting important gatherings. The accusations of medical anxiety and hypochondria hung in the air like smoke from an extinguished candle. Madison's confident medical expertise was crumbling as she processed the reality of actual pathology reports. The reason I came tonight, Dr. Peterson said, consulting his additional files, is that today's staging scans show concerning developments that require immediate family consultation. Mrs. Whitmore, still holding her donation check, looked confused. Concerning developments? The lymphoma has progressed despite treatment, Dr. Peterson explained gently. We're now looking at stage 4 disease with bone marrow involvement. Ms. Morrison needs to make critical treatment decisions within the next 48 hours. The charity gala celebrating cancer research had become the setting for my family's confrontation with actual cancer progression. Dr. Peterson spread additional scan images across our charity gala table, transforming the elegant fundraising event into an emergency oncology consultation. The contrast was devastating. Lymphoma progression reports displayed among auction items for pediatric cancer research. These are yesterday's PET scans, Dr. Peterson announced, his voice carrying clearly enough to draw attention from nearby donors. The bright areas indicate active lymphoma in Ms. Morrison's bone marrow, spleen, and liver. Stage 4. Metastatic lymphoma. The words hit our table like a physical blow, destroying any remaining illusion that my medical appointments were fabricated anxiety. Bone marrow involvement means we're looking at potential bone marrow transplant, Dr. Peterson continued, consulting his notes with practiced compassion. Without immediate intervention, the 5-year survival rate drops to 30%. Madison's face had gone white as her pediatric cancer research expertise forced her to understand the implications of advanced lymphoma staging. 30%? Dad's voice was barely a whisper. But she looks fine. Ms. Morrison has been managing her symptoms exceptionally well, Dr. Peterson explained. The fatigue you may have dismissed, the weight loss you attributed to stress, the frequent medical appointments you questioned, these were all signs of progressive lymphoma. The devastating realization was spreading through my family like poison. While they'd been celebrating Madison's cancer research and dismissing my diagnosis as attention-seeking, I'd been quietly fighting for my life between their charity galas and professional achievements. The bone marrow biopsy we performed yesterday, Dr. Peterson said, opening another medical file, shows 90% lymphoma cell infiltration. This explains the rapid progression despite chemotherapy. Mom made a sound somewhere between a gasp and a sob. Catherine, why didn't you tell us how serious? Because I wanted you to have normal charity galas, I said weakly. I wanted celebrations of Madison's research success without my cancer survival statistics overshadowing everything. Dr. Peterson checked his secure phone with medical urgency. The transplant evaluation needs to begin immediately. We're looking at a very narrow window for successful intervention. As my family processed that their hypochondriac daughter was dying of metastatic lymphoma while they'd spent months mocking her cancer diagnosis at charity events dedicated to cancer research, the irony was suffocating. 2 hours later, the charity gala had been abandoned as my family accompanied me to the hospital for emergency bone marrow transplant evaluation. The evening that had begun with Madison's celebration of pediatric cancer research had ended with my adult cancer crisis. The transplant protocol will require intensive family support, Dr. Peterson explained as we arrived at the oncology unit. Bone marrow transplants have significant complications that patients can't manage alone. Madison was crying now, her research credentials meaningless against the reality of her sister's terminal diagnosis. "Catherine, I'm so sorry. My medical training should have made me recognize the signs. I failed you as both a doctor and a sister. You saw what you wanted to see," I said quietly as nurses prepared me for immediate admission. As the transplant team discussed donor matching and survival statistics, I thought about the cruel irony that it had taken stage 4 lymphoma progression to make my family understand that some medical appointments are matters of life and death. Some cancers, after all, don't wait for family acceptance to become real.